Did you know that stretch marks are scars? Exactly. Stretch marks are scars. What are they caused by? By breaking the elastic fibers that support our skin. There are three types of stretch marks. The red stretch marks, which are those little red ones, the purple ones, and the alba, which are those white ones. I will teach you how to prevent and how to treat it at home, and also what are the best treatments in an aesthetic clinic. Stretch marks are caused by the breakup of the supporting fibers of our skin. How does this happen? And why does this happen? Well, it occurs by tissue stretching, one of the factors. What is stretching? Let's talk about a little child. When she reaches their 12, 13 years old, becomes enormous. This growing process breaks up the fibers, which can stand it, and keeps up with that stretching. It ends up breaking, generating stretch marks. There's also the rebound effect. What is the rebound effect? When the person gains lots of weight and loses this weight too fast, the skin cannot handle it, and it ends breaking up also. There is also the genetic factor. There are people who also take corticosteroids for a long time, causing it, and the people who go to the gym, got it. They want to stretch here, there, get more muscle. Suddenly, they will destroy the skin supporting fibers, forming several stretching marks, which is nothing more than a scar caused on the skin, because it didn't withstand this sudden effect. I will give you an example. Let's get a balloon, a brand new, nice and pretty balloon. You feel it. Does it get back to normal? It won't go back to normal ever again. So with stretch marks, it's the same thing. Is there any way you can get the body tissue back to normal 100%? You can certainly soften it. Did you get it? Make it look a little nicer with a look that provides a better appearance, because it's not the case for some people, aesthetically speaking, you know. Gee, Patricia, and what can I do? What can I do to improve my stretch marks aspect? Well, first you must know that there are three types of stretch marks. The red one, the little red one, which is in what phase? At the beginning of the inflammatory process. That's why it itches. You know, let's say you are a mother up to giving birth, or you who gain and lost weight quickly, who stretched your skin. Then you notice those red welts. Got it. Gee, it's itching, folks. The worst thing you will do is pick up your fingernail and scratch it. What are you doing? Increasing this inflammatory process. You are increasing the breakdown of these fibers. Do not do this under any circumstances. Gee, Patricia, but it itches and itches a lot. What do I do? Apply an appropriate cream to this area that is bothering you, that is itching, and apply the cream with your fingertips. Massaging nails, never. Do not rub it against clothing. Oh, but I'm going to do it through the clothes. You are causing friction. It will get worse, okay? So when it's in the red state, it's in the high-net process of inflammation. What am I supposed to do? Well, what I'm going to say now, it works for both red stretch marks and pregnant moms. During the red state, we must lower your skin inflammation. Then you can use hyaluronic acid, gotu kola, aloe vera, vitamin E, and vitamin C. It helps to produce collagen. The gotu kola and aloe vera both have calming actions. This is really good for moms because it doesn't affect your baby. And during the inflammatory process, you can also take a water pouch, chill it, and put it in the region. Is this nice? This is so wonderful. Why? It will lower this inflammatory process, and by using these products, what action do they have? Anti-inflammatory as well. So what are you doing? You are preventing this stretch mark from evolving and get that ugly look. Will it happen? It might happen, but will be very mild. What about the purple one? Purple is already in the intermediate state, is already finished the inflammatory process, and it is in the middle phase. It is neither at the beginning nor at the end. So what do you have to do here? The same thing. You must moisturize and moisturize that skin a lot to try to reverse this process. Lots of hydration. If you're not pregnant, you may also use urea. A lot of hyaluronic acid, go to cola, light exfoliations in the purple state, do you follow me? And leave that skin with a lot of elasticity also through vitamin C, providing high hydration. Gee, how interesting. Hey Patricia, I had mine for years. What should I do? The process is the opposite of the red stretch mark, the alba, which is known as little white. You must exfoliate it. You must provoke the inflammatory effect, unlike the other one, which must be lowered. In this one, it needs to be increased. Why is it white? It turned white from lack of blood in this region. Therefore, you have to bring the blood back to this region. How do I do this? Retinoic acid, lots of exfoliation in this region. You have it once or twice a week. Apply plenty of moisturizer. You may also abuse of urea, hyaluronic acid, go to cola, vitamin E, vitamin C. What you must do there is to cause a little inflammation. Gee, what do I do? Do I put that cold pouch? No, it's the other way around. You're going to put a hot little pouch. Because what I want now is to increase your blood flow, increase the oxygenation, bring that blood back to the surface. Got it? Place the hot bag, then you exfoliate and apply these moisturizers. This will have a wonderful effect. Very good. Stretch mark exfoliation can be done twice a week. Okay, Patricia, what exfoliators can I use? I don't have acid. You can use a vegetable brush. Your skin must become red. Oh, it's turning red. It's about to turn red. Not to bleed, but if it's turning red, it's a good sign. Apply retinoic acid, do the exfoliation, which may also be done with sugar, cornmeal, or even with the coffee grounds, no problem. Now, a particularly important tip, folks. For you who are treating your stretch marks, no matter at which stage, caring for the sun exposure requires extra caution because the region that is recently red, if you go to the sun, it will pigment. Turns into a stain. You who are treating the purple one, if you expose yourself to the sun, it will turn into a stain as well because you cause the blood to come to the surface. This triggers the inflammation process. So what do you have to do? While you are doing the stretch mark treatment, avoid sun exposure. Keep your clothes on. Apply sunscreen if it's daytime. At night, lots of hydration. If you do this over time, I guarantee you will see a big significant improvement because what will happen? Tissue regeneration, meaning with exfoliation, with hydration, you will reduce that scar. But remember, it will never go back 100% to what it was, but there will be a significant improvement. Reinforcing. For the white stretch marks, you must cause skin aggression. For the purple stretch marks, a moderate aggression. And for the red stretch marks, you must get this inflammation down as much as possible. Anything else? Use some types of oils. For example, coconut oil is excellent for hydrating the skin. Castor oil is also used in stretch marks, as well as rosehip oil or sweet almond to be able to moisturize, leave your skin very hydrated. I made videos of coconut oil and castor oil. Take a look. These videos are really cool. What else do I recommend? There are treatments in aesthetic clinics. What for? To enhance this treatment performed at your home. What are these treatments? Microneedling. It is particularly good. Chemical peeling, vacuum therapy, pulsed light, and laser also. There are several treatments in aesthetics which will enhance this treatment you are doing at home, bringing you a faster and more satisfying result. And if you like this video, subscribe to my YouTube channel. I'm always posting news about aesthetics and health. And also leave your comment. See you in the next video.